Hello everyone, welcome back to my channel, Fetal Insights. If you are new to this channel, we discuss, share and advocate for best modern practices in pregnancy management. In this tech-saturated world, technology has taken a lead and even pregnancies are best managed with the modern technological ways. And we are here championing fetal medicine as the best mode of pregnancy management. Without taking much time, guys, today we're gonna discuss on fetal assessment. This is the assessment of the unborn babies. How do we assess and what are the things that we look for when we are in fetal medicine? Fetal assessment is done by an ultrasound scan, and we are happy and good to say fetal medicine scans are modern and they're also high quality ultrasound scan machines. What do we check for when we come for fetal assessment? Definitely, we can't assess a baby without history. History taking is of great importance. Mom should give us a brief history of herself, brief history of the pregnancy. We need to know last normal menstrual period. This is of great importance to get or understand the fetal weight, estimated date of delivery, and also to check how this baby is growing. However, with modern technology, last normal menstrual period is not really of a big deal, though we need it. But a first trimester scan is also known as the dating scan, and it gives us much accuracy, plus or minus 7 days of estimated date of delivery. Okay, if you come for a fetal assessment, it means that you need your baby to be checked if this baby is fine. So it's kind of fetal well-being scan. From the fetal assessment, that's when we come out with the diagnosis either of normal fetal growth or a complicated pregnancy which needs follow-up care. In fetal assessment, we check for fetal heart rate, which should be within normal ranges. However, if it's not within normal ranges, it means either we have a fetal heart rate which is below standard, and this might mean that this baby is in fetal distress, or that this baby has got some fetal heart defects. And this recalls for proper, well-detailed assessment to actually find out the reason why this baby has got a slower heart rate. And if the baby has got a faster heart rate, it might mean that this baby is stressed or anxiety, or even umbilical cords have got a tendency of strangulating the babies and they undergo stress. So we also check why this baby has got a faster heart rate. Mind a disclaimer, I might not use much of the jargon or medical jargon for everyone to understand. In regard to fetal heart rate, let me also put it across that fetal heart rate depends by gestational age to say this is normal or abnormal. Some of the fetal heart rates which are beyond 160 are normal in first trimester, and a fetal heart rate which is below 120, at least 110 to 120 might be very normal in labor, because this baby will be under stress, need of coming out. And then we also check for placental positions. Where is the placenta? The placenta has got normal size to be on, and it shouldn't be on the birth canal. And let's also say this placenta is assessed for size. We also assess for appearance and position, and also to check if we only have one placenta. We have pregnancies with tendency of having two placentas but with one baby, or an accessory lobe. It's possible. We also check for fetal position. How is the baby lying in utero? We have a position we term this is normal for a baby to lie like this. That's when the head is down, which we term cephalic. We say this baby is lying normally. However, if the baby is up, what we term breech, or in transverse or oblique, it means this baby is not in normal position, and it might need delivery plan according to gestation, also according to parity, and it would also be according to delivery plan. It depends. We also check for amniotic fluid, which should have a normal range. Excessive amniotic fluid means that this baby has got some problems, and some of the babies might be having some fetal defects. And if we have very little amount of amniotic fluid, it also shows that this baby has got risk either of premature delivery, or it might also have some problems or even fetal defects, because this baby, amniotic fluid is from the baby's wee, and if baby is not weeing, it means that this baby has got some problems as well. So it would also call for excessive assessment, well detailed, and actually a deep understanding of why this baby is not passing wee. And we also check for estimated fetal weight, which should correspond to the last normal menstrual period date given by mom, or it should correspond to the first trimester ultrasound scan estimated date of delivery. If this baby is growing bigger than the dates delivered or smaller than the dates given, it means that this baby has got some conditions to be assessed. Either this baby is macrosomic, it could be caused by mom's, if mother is diabetic, or if there's any history of diabetes, or if the baby, the fetus, has got diabetes, or sometimes we have whereby we say, this head is not appropriate to the age, and later on we discover that this baby has got some hydrocephalus. So this also calls for assessment. And we might have a very small baby, possibly from if mom has got preeclampsia, or this baby is just constitutionally small just because the parents are small, or just because this baby is a small baby, or has got some problem. We have babies with some microsomic heads just because they've got some deformities. So it also calls for extra assessment. And then we also check for estimated date of delivery, which should correspond to the last normal menstrual period. We also check for fetal Dopplers. They indicate how blood is flowing in the baby, and if baby have got some conditions. They indicate if baby has got fetal anemia. They also indicate if baby has got some deformities. So in addition to what I've just said, we also check for head to toe assessment. That's to examine the baby if baby has got any problems, or if everything is within normal ranges. Maternal condition also determines the fetal health. And if mom has got preeclampsia, in some pregnancies, this condition leads to baby having fetal growth restriction, baby not growing normally, or being very small for the pregnancy. So we need to also check the mom, treat some infections, give or some recommendations or advise in some conditions for the sake of the fetus. A growth scan or a complicated scan, and management would differ according to results. Even the follow-up care would depend by results. I would like to encourage every pregnant woman to adhere and comply to the recommendations given by specialists in regard to your results. So this will take us to a discussion of a normal fetal growth scan. For more content like this, subscribe, comment, share, and like. Thank you.